Let me see how you can think through this question.
Yeah. Okay.
Answer this one.
All right. The nurse is talking with the client who has diabetes mellitus type 1 and is receiving insulin via an infusion pump. So the nurse is having a conversation with the patient who has diabetic and is getting the insulin. Which of the following statement by the client would require follow-up? So which statement that the client talks about it that the nurse needs to intervene, that is wrong? So one, I need a bolus dose of insulin prior to a meal. Mm, okay. So I need a bolus dose of insulin prior to a meal because I know whenever you get an insulin, you need to have a plate with you. So that's correct. I should refill the pump with short duration insulin. So I don't understand what they mean short duration. I'll put it a question mark. I'll continue to 3. I can decrease serum glucose monitoring to twice daily. Why can I can decrease serum glucose monitoring to twice daily. So it's just monitoring. So it's not a, I will put it a question mark. I will change the infusion needle every 2 to 3 days. So I believe if we keep changing, we can cause infection, right? That's my point. So I'm still stuck with 2.
All right,
So I will choose. Yeah.
let me give you a breakdown. All right.
Mm-hmm,
Now, look at the question. The question is
mm-hmm,
saying the nurse is talking with a client who has diabetes type 1 and receiving insulin via an infusion pump. So now, this is how you think about your question. You need to understand yourself as a nurse, right? Now, they said the patient
mm-hmm.
is having diabetes, right? And they are
Yeah.
receiving insulin, right? So the diabetes is no more a problem because obviously they are already receiving what? A solution
Insulin.
to that particular problem. So the main focus of the question will be related to what? The intervention. So is it that the NCLEX can test us related to what? Follow-up related to that intervention, problem related to that intervention, or anything just related to intervention. So the real testing point here is the insulin that they are receiving via what? The infusion pump. Right. But you can see what the question said. It said the nurse is talking. If you read most of your NCLEX question, it always used to say the nurse is caring. Now, if the nurse is caring, it means the nurse is just doing the process herself. Now, but when a nurse is talking, it means that these are the keywords: talking, teaching, thought. Those are the keywords, right? Because you are talking with what? The patient, and then guess what? You are going to get feedback from the patient as well too. Because when you are talking, you are not the only one going to be talking to the patient. The patient is going to be talking back to you. Am I making sense?
Mm-hmm.
Right. So now look at the examiner question. The examiner is now saying which of the following statements by the client would require follow-up. Now, this patient had all the statements for you. Statement 1, statement 2, statement 3, statement 4. Now, when the NCLEX use talking, teaching, thought, it's always pick one thing. There's a particular thing that they were talking about, and there was a required feedback towards that particular thing, or a required statement that the patient is supposed to say towards that particular thing. Now, this is the statement right here. I need a bolus dose of insulin prior to meal. That is the patient statement. I need what? A bolus dose of insulin prior to meal. So now the thing that you're asking yourself is, do we take insulin, right, alongside with what? Meal? Because a bolus dose of insulin prior to meal, right? Do we what? Take insulin alongside with me? The answer is yes. So this don't require what? Follow up, right? Let me erase this. Now, this don't require follow up because it's correct. We what are they calling it? We give insulin alongside with milk. The reason why the question is talking about bolus dose in this question is because what we are using to give the insulin is infusion. So bolus dose is the one that is related to infusion, but bolus dose prior to meal, yes, that's correct. Right, no follow-up required. Now I should refill the pump with short duration insulin. Now we have long duration and we have short duration. Right, you don't refill the pump if you are using what? Long duration insulin. But if you are using short duration insulin, meaning you might get it 3 times in a day, you need to refill the pump, right? Because it's short duration, it work from so time to so time, then you take the next one. When it's refilled, it work from that time to another time, you take the other one, something like that, right? Depending on um the doctor specific order, right? So since it is short, the keyword is that yes, we want to refill the pump, but we don't refill long, because long should work throughout 24 hours. Am I making sense?
Yeah.
Right. So, but since this is short, yes, we want to refill. So these don't require what? Follow up as well too. Now, look at number 3. It said, I can decrease serum glucose monitoring to twice daily. Now, yes, we want to monitor our glucose level. Now, the key thing is this. Anytime you are trying to monitor for something, we don't decrease it. It's just like right now telling your patient that, oh, you need to decrease the amount of time you check your blood glucose level. Does that make sense to you?
Yeah, it
This
doesn't.
patient
Yeah.
are having diabetes and they are using insulin. This patient can be at risk for hypoglycemia anytime. So why do we want to decrease? Because we want to make sure this patient is monitoring their blood glucose level regularly, not to decrease it. You understand? The fact that they are trying to decrease it scream what? Red flag.
Yeah.
Yes, they might increase, but we don't do decreasing. When we are trying to monitor anything, we don't decrease the amount of time we are monitoring our patients or monitoring for any particular procedure, treatment, or medication. We don't decrease it. It's just like saying patients should decrease the amount of time they check their blood pressure. No, we don't decrease. Right? So the keyword right here is decrease, that is screaming red flag. So now this is what require follow-up, because the patient is saying I can't decrease my serum glucose monitoring to twice. No, you cannot. Not even when you are receiving insulin, because you are at risk for hypoglycemia, you cannot decrease it. You cannot. So this is the one that require what? Follow-up right here. I can change my infusion needle every 2 to 3 days. Any kind of needle you can change it, because using the same needle all the time creates risk for what? Infection. That is the reason why you want to change your needle. Anytime you are doing invasive procedure, that particular equipment that we are using, you must change it. The timing for changing can matter, but the fact still remain that you must change it. Catheter will change, needle will change, IV access will change, urine catheter will change.
Mhm.
Your what are they calling it? When you are giving patients TPN, you
Yeah.
change every day, right? The timing for changing, right, is not the problem. The fact that we change it is the problem. I'm not sure if NCLEX will likely test you on the timing for changing, because the timing for changing might be a whole lot to start thinking about. Because now you will change infusion needle 2 to 3 days. For TPN, you change it every day. For your catheter, you can change it maybe after 72 hours, right? Your central line catheter after 72 hours, your uh maybe urine catheter also still fall under same category. But the timing is not the one that is the problem. The fact that we change. So NCLEX want to test your ability to understand that that particular thing you need to change it. And why are you changing it? We are changing it to prevent what? To reduce the
Infection.
risk of what? Infection. So this is the correct thing to do. It does not require follow-up. So number 3 is the one that what? Require follow-up. Am I making
Mm.
sense?
Yeah.
All right. Are you ready for the next one?
Yeah. Let's try.
Oh, okay, great. Now, if you're answering question, try to think through the reason of why we are doing
Mm-hmm.
that thing. so that at least you can
Okay.
have a bigger picture of the thinking process. Answer this question.
The nurse is assessing a client who had cardiac catheterization 2 hours ago. Which of the following findings would require immediate follow-up? Okay, immediate follow-up, the one that you say that's a priority, right? So blood pressure 104/70. So the blood pressure is not bad. If it was under below 100, like on the 90s of 60 or whatever, I would question that. And 2 plus 1 pedal pass of the affected extremity. Plus 1. Because I know 2 is normal, 3 and 5 is hyper, and 1 and 0 is hypo. So I'll put it a question mark. Heart rate of 98, which is good. It's on the normal limit. And urine output of 100 ml for the past 2 hours. So I know 30 to 60 per hour. So in 2 hours, we either need 60 or 120. So this is right. So 3 and 4, I'll cancel that out. I'll cancel 1 and I will go with 2.
All right, great. Nice breakdown. Nice understanding of what various assessment. Right. So the correct answer definitely is 2, right? When question is testing you related to immediate follow-up, most of the time you don't even need the body of the question to be able to break it down. Because immediate follow-up automatically tell you one thing. Immediate follow-up tell you that there's something that is threatening the patient's what? Life.
Mm.
Right? There's something threatening the patient's life. So you just need to think about it now. If you look at that previous question we answered, there's something that is threatening the patient's life. And what's threatening the patient's life? The fact that the patient is saying they need to decrease the amount of what?
The
Checking their
blood.
blood, their blood glucose. It's going to threaten the patient's life, not even when the patient is using insulin. Am I making sense? Now,
Yeah.
so even if I don't even know what is this, the fact that I'm thinking about what is threatening patient life, I can easily be able to navigate it, and you're able to break this question well. Immediate follow-up. What require immediate follow-up? This fall within range. Your blood pressure is 100 to 120 systolic, 60 to 80 diastolic. So this is within range. No follow-up. PDA pause, we have +1, right? 2 plus, 3 plus, 4 plus. This is not that good. This is terrible. This is best. Right. So understanding that this is good and the patient is having one, this is terrible. So this require what? Follow up. But I still need to look at the remaining to also be sure. Heart rate 60 to 100. Good. Urine output 100 ml in 2 hours, and you were able to break it well. Correct urine output is 30 to 60 ml per hour. Right? So if in 2 hours, then that would be like 2 multiplied by this. That would be
Mm.
60 to 2 multiplied by this. That would be 120 in 2 hours. So it's within range. So since it's within range, then that's fine. So this is not a problem. So the answer you are left with is what? 2. So 2 is the
2.
problem right today. You understand? Because
Yeah.
now the NCLEX is just trying to test you something, because the biggest safety related to cardiac catheterization is checking for the pedal pulse. That is the biggest safety. If there's absence of pulse, you need to call the doctor immediately. Remember, you did not carry out the procedure, so you cannot do anything about the procedure. It is the doctor that
Yeah.
carry out the procedure. So it's the doctor that need to do something. That's the reason I always used to tell students, when you are reading your question, always know who is carrying out the procedure. Is it a nursing procedure? Is it a medical doctor procedure? So that you can easily be able to think through the answer. Am I making sense?
Yeah.
All right, great. Let me see if